This is Dr. Opdahl again. We've already talked about the anatomy of the spine and what causes low back pain. In the last video, we talked about the 3 phases of healing, and now we're going to talk about what you need to do in each phase in order to get out of pain and get rid of chronic back problems. Phase number 1 is the inflammatory response. In the inflammation phase, your job is to get rid of the inflammation. You do that by avoiding any activity that could possibly cause irritation and pain to your lower back. The second thing you need to do is to get the joint moving as quickly as possible. This is very tricky to do because movement will typically aggravate lower back pain. In our office, we use adjustments. They're very effective to mobilize the joint without irritating the joint. Some people will also take ibuprofen, which is an anti-inflammatory. It will chemically reduce the swelling in those areas and can be very effective at reducing inflammation. Ibuprofen is a medication and should be taken with caution because it is very effective in the inflammatory stage, but can have repercussions in the repair stage of healing. So you should only use it if there's acute inflammation. Also understand that ibuprofen has not been shown in any research studies to actually aid in the healing process. So it should only really be used as pain relief if you're miserable. If you need specific instructions on which activities you can and cannot do, or help figuring out how to avoid pain and minimize inflammation, that's when you're going to need to talk to a doctor. In the repair phase of healing, your body is going to be producing a lot of temporary scar tissue called type 3 collagen. In this phase, the goal is to stretch and move that scar tissue as aggressively as possible. Now you have to be careful. The more you move the scar tissue, the stronger, more flexible, and better it becomes. In fact, not moving it enough results in permanent damage to your back. So the goal is to get the disc and the ligaments moving to their fullest extent possible as quickly as possible. The problem is, in this stage of healing, the back and those ligaments are very weak and vulnerable. So if you're too aggressive and stretch it too much, you're going to tear it and damage it. So this is a very difficult, tricky part of the healing process. How do you get the joint moving? How do you effectively stretch and mobilize the scar tissue without damaging it? In our office, we use adjustments, exercises, and what we call traction to aggressively stretch without ever damaging, irritating, or inflaming the ligaments and the disc in the lower back. In the remodel stage of healing, your body is going to be replacing all of the type 3 collagen it just made with a more permanent, stronger type 1 collagen. The goal in the remodel phase is to encourage this process. You want your body to replace all of the type 3 collagen with type 1. And the more physical activity you engage in the remodel phase, the better it's going to heal. So we want you doing things like weightlifting, yoga, stretching, exercises, anything, and the more the better. You still might have some weakness in your back. It isn't fully healed. So if you're too aggressive, again, the rule is stretch and move as much as you possibly can in as many different forms as possible without ever causing pain, swelling, or irritation. If you do anything too aggressively, you're going to re-tear the tissue. And that's going to start the inflammatory response all over again, and you're essentially starting the whole process over. To summarize, in the inflammatory phase, avoid pain. Avoid anything that will trigger more inflammation and swelling. A big mistake is stretching too much. Second, in the repair stage, you want to do as much aggressive stretching as possible. Traction is the most aggressive way, but it must be done judiciously to prevent re-injury. Adjustments are the gentlest way to do it, but they're not aggressive enough. They're not going to get you the best long-term outcome. And in the remodel phase, we want all kinds of physical therapy, we want exercises, we want stretching, again, as aggressively as possible, as much as possible, without ever irritating, damaging, or inflaming the lower back and starting the whole process over. This is a very brief summary. I could go into a lot of detail, but I hope I've answered a few of your questions and have pointed you in the right direction if you need more information on this.